Good morning, good afternoon, everyone. Welcome to today's Fed Talk titled Intro to Health Policy and Legislative Advocacy. All chat and questions should be entered into the chat box, and or you can raise your hand and we can ask questions at the end of the presentation. I am going to turn it over now to our presenter, Connie Moody from IPHA. Connie?
Thanks, Lainey. Good afternoon to everybody. Thanks for joining us for this Fed Talk. This is one of my favorite areas to talk about, and that is health policy and legislative advocacy. I spent almost 30 years with the state health department and worked on health policy issues and legislative advocacy on a number of different issues, ranging from childhood-led programming to breast cancer, chronic disease, and late in my career, the medical cannabis program. So, like I said, this is one of those areas where I really enjoy talking about to students, to young public health professionals, and seasoned professionals, because this is where we can really make a difference and have an impact. We're going to talk a little bit about public health advocacy. We're going to go into detail on how you can make a difference, how you can take action to speak to policy and decision makers, and some of the do's and don'ts. I always like to talk a little bit about public health advocacy at the very beginning, and now in these times that we are in, after the COVID-19 pandemic, it really has changed not only how we public health professionals think about policy and advocacy, but also how we need to take action. Really, in the decades that preceded the pandemic, our academic institutions and our local health departments, our public health professionals, we always really distanced ourselves from taking action on the public stage, whether that was political advocacy or just personal advocacy. But as our society struggles through the evolution of COVID-19 and the impact of that pandemic on our public health programs, on our public health departments, and on our general population, we really have to ask ourselves a very crucial question, and that is, are we preparing the next generation of public health practitioners not only to investigate the harms to health, but also to advocate firmly for the best approach to advance health? And we have to do that really for our most vulnerable populations, those who are disproportionately affected by health inequities, because that's where we can give those populations voice. So how do we do that? Well, the answer is really policy development and the ability to create, champion, and implement policies, plans, and laws that impact public health. And we'll go into that a little more deeply in this presentation. But I think it's good for us all to remember that some of public health's greatest achievements, whether it was sanitation with the original pump handle, or workplace safety, tobacco prevention and control, those changes in our laws and the way that society reacts to them are really policy changes. And those were informed not only by the research, by what all of you do every single day, but also the concentrated efforts of our public health advocates. So why should we advocate for public health? The Journal of School Health really has a great definition that I like about health advocacy, and it talks about the processes that the individuals and also groups take in order to bring about change. And those changes are made on behalf of a health goal, a program, an interest, or a population. So society really depends on knowledgeable policymakers to enact laws that make our communities safe and promote healthy living. And for those policymakers, it's imperative that public health professionals like ourselves who have the expertise, who have the data behind us, and who have the experience can educate lawmakers and decision makers through evidence-based research. And again, you all know that during this pandemic, there was a real dislike for the evidence base. And that's something that we have to continually keep up that drumbeat to ensure that our voices are heard, because again, we have that experience, we have the expertise, we have the knowledge and the data. So I like to talk about advocacy as being part of policy development. And one of the foundations of public health is policy development. And you hear this, you see this in the 10 essential public health services wheel that is currently on screen. That was, this graphic is from the American Public Health Association. But this is really part of the foundation of public health. We all know that those three foundational pillars are assurance, assessment, and policy development. That then later evolved into this detailed 10 essential public health services. And you will see that on the right-hand side of the wheel, policy development really takes several different approaches, whether it is legal and regulatory actions, or it is communicating effectively to inform and educate. And really that communication piece, and then also the light green essential health service that is creating, championing, and implementing policies, plans, and laws, really falls under that policy development. And that is a very critical component that supports assessment and assurance. Now, when we talk about this, many folks in the public health world or in academia ask, is advocacy lobbying? And aren't I prohibited from doing that? And there are some very distinct differences. While advocacy is really very central to public health, we wouldn't have seatbelt laws, for example, or clean water or nutrition labeling without advocacy. But there is a difference and a distinction between lobbying, which is really influencing a legislative body on a very specific action. So that is indeed something that is not necessarily appropriate for an organization, for example, a non-for-profit organization, but there are multiple ways that we public health professionals can communicate to our policymakers. We don't have to ask them to take action on a specific bill, but we can educate them about the content of that bill and how it could help or harm our population. So we really have to be able to differentiate between advocacy and lobbying. Your organization also might have some very specific rules about when you can and cannot advocate, or who you may or may not be able to talk to in your official capacity. And so those are things where you should talk to your internal, your compliance officer, your executive director, your administrator, about what those distinctions are. But as far as advocacy goes, local health department staff and public health professionals are really key players, because again, we have that experience and expertise. Now, we often talk about different public health advocates, and clearly the Illinois Public Health Association is a public health advocate. That's part of our mission, as is the American Public Health Association, of which we are an affiliate. But there are many different public health advocacy organizations that are all doing work in this space. And I've just put a sampling of those organizations on the screen, on the slide. You'll see that some are very, very specific to an issue area, such as the tobacco control network. Some of them are focused more on clinicians and healthcare providers like the State Med Society. And others take a broader approach to a population-specific area, such as the Asian Health Coalition or the Hispanic Health Coalition. Now, some of those organizations may have other missions also besides advocacy, but these are some of our partners, and there are many, many more of them out there that I did not have room to list, but these are some of our partners. And by knowing what our partners' positions are on different issues, what their approach to advocacy is, we can often work together. We can partner on advocating for public health issues because we may have similar goals. We may be serving similar populations. And so we can often help each other by being aware of what these organizations are working toward, what their position is on different issues, and then plan how we can support each other. There may be cases where we support an organization's position on a particular legislative issue, but we don't support all of their policies or all of their approaches. And so that needs to be taken into account also as you make decisions about who to partner with and how to advocate together for issues. Advocating for public health takes a wide array of approaches. There are many things that we can do as public health professionals. We can meet with legislators and local leaders or other government officials to discuss, for example, funding or a particular health issue area. Sometimes that has to take place in the legislator's district. When they are in Springfield at the Capitol, it may not always be the best time to connect with them on issues. And I think it's very important that we don't forget our local leaders or our government officials. For example, our mayors. They are also involved at the state level through the Association of Mayors. And what they say in those meetings to other mayors about a particular health issue in their community, there's another way to have a voice. There's another way to educate and advocate for a public health position. Another area is government officials. We often forget that the state agencies that we work with, that they also have an impact on public health issues. The General Assembly may ask those state agency staff for input on a particular program, local community. That's also an opportunity to advocate for members of the media may come to get detailed and accurate information about the programs that you have implemented or about health issues and how they're affecting your community. Those are all very successful ways to advocate for public health. And part of that involves storytelling, and I'll get into that in a few minutes. Tweets, if you are on social media, tweeting statistics, for example, about STDs in your community, or providing descriptions of how the public health partners in your community are working to reduce those rates. That, again, is a way that we can advocate publicly for public health. Your organization may have an e-newsletter or a policy brief that they distribute to share factual information about public health issues or to highlight programs. One of the most effective things that our public health, our local health departments and community-based organizations did during the pandemic was to highlight programs that were working in the community to reach people who needed access to supplies or who needed access to COVID-19 vaccinations. That was a really effective way to highlight the power and the effectiveness of public health during the pandemic. Another opportunity is speaking to local organizations or civic groups or even students. if you are interested in going to the university, I know many of our partners look to have presenters, guest lecturers, for example, at the university. Some of our civic organizations, Kiwanis and Rotary, and the Area Agency on Aging in your community may be a really great opportunity for you to share information about the programs and the policies and the work that you are doing. That's an effective way of advocating. So as you're hearing some of the things that I'm saying, you'll note that most of this is about education. That's really what advocacy is. When we advocate for public health, we are educating on public health issues. Now, at this time, as I said before, this is one of the most important timeframes for advocating about public health. Because of the COVID-19 pandemic, we as public health professionals have really lost a lot of ground. There are many who do not want to listen to us because the decisions that were made, the policies that were enacted during our response to COVID-19, although we personally didn't make those decisions, we are being blamed for them because they infringed upon someone's personal rights, or people's perception was that public health shut down a restaurant or a small business. But right now is the time when we have to advocate more strongly than ever before, because there are many at-risk populations who, without us, don't have a voice at all. So right now is a great time to communicate, but it has to be an effective approach to communication. The Du Beaumont Foundation and the Aspen Institute researched ways to frame and communicate on public health issues. And they found that there were some very specific ways that resonated with legislators and with policy and decision makers. And that is not just throwing about statistics or telling people that they must do this in order to achieve optimal health. Really, it's a multi-sectorial approach. Our messaging and our communication on public health issues is really to build understanding and support around those issues. We have to underscore today more than ever that community health efforts to improve the health of our communities really rely on a strong multi-sectoral foundation. And that means working with our partners. So this is not just the public health department or the local health department. This is not just your organization. This is about a multi-partner approach. Think about that slide that I just showed where there were multiple partners listed on that slide. Those are the folks that you need to work with and talk to and partner with on these messages. We also have to underscore the use of data to make our way toward a better community health outcome. So this is not this is a message that uses data, but uses it in a way to tell the story so that we are actually showing how, for example, vaccination, increasing COVID-19 vaccination led to a reduction of COVID-19 deaths in the community, or how improvements in regulation of smoke-free public places resulted in a decrease in smoking rates and smoking uptake rates by young people. So not just presenting the data, but presenting the whys. And then also collaboration on public health issues results in both short-term and long-term gains. we have to remember that our legislators and our public officials, even our state officials, are sometimes in time-limited positions. Legislators are often thinking to the next election cycle, or are focused on the next budget cycle. That's the same with local officials. State public health and other agency staff are focused on a 3-year grant or on a 5-year project. So we have to make sure that our messaging is about both the short and the long-term benefits. And above all, we have to encourage our policymakers to incorporate health considerations into their decisions across all different policy areas, whether it is a communicable disease program or grant funding to local health departments, or a built environment decision, for example, a new funding for new bike paths and walkways within a city or within a community. So how do we do this? Talking about public health, it's not easy. We have to get our messaging across, and we have to tell the story of public health. So it's really almost taking us back to school when we learned about the 5 W's, right? Who are the people who are involved? Who are we telling a story about? Is it a population within a community? Is it young people who are starting to access vaping devices so that they are becoming increasingly encouraged to pick up a cigarette and smoke a cigarette? Is it a family who has been impacted because of windows in their home that have lead content? Who are the people that are involved? That really makes the most, has the most impact for a policy and decision maker if you can take it to that level. What goals are we working toward? Explaining why a piece of legislation or why a policy approach has a specific impact on that population or on that community, and what they're trying to achieve with it. What problems stand in the way? Talking to a policy and decision maker about the problems that may come up in enacting a specific piece of legislation, or how a reduction in funding might have an impact on a specific population. And then ultimately, how will public health solutions benefit individuals and communities? So what is that benefit? Why are we doing this? If you can talk about the story of public health in all of these ways, it is much more compelling and much more effective than simply citing statistics or telling somebody, no, this is not a good idea. So I mentioned the words telling the story, and this is something that public health professionals need to learn. We're not always very good at it because often there's no story to tell. You know, when things are going really well, public health is not in the news. We don't make the media. Now, when things are going really badly, of course, then all attention is on public health. But most of the time, you know, we public health professionals are trying to prevent poor health outcomes. So we're not always, we don't have that opportunity to share information. And that's where telling the story is really, really important. And it starts with relationships. Because at its very foundational level, advocacy is really about building relationships, becoming that valuable resource for policymakers. Because we want policymakers to come to us and count on us to be that voice, to count on us to be the individual or the organization that has factual information, to be that trusted voice in the community. So when you are telling your story, you need to be confident, of course. You need to frame your message so that the policy and decision maker understands the so what. And that goes back to some of the things that I said on the previous slide. Who does this policy affect? How does it affect them? What is the outcome that we want for the who's? You really have to plan and practice your message. And if that means an old tried and true trick of standing in front of the mirror and practicing your message, that's a good approach. Get one of your colleagues to listen to your pitch, to listen to the way that you're going to present the facts. If you're writing a message to an email or a longer communication, a letter, for example, to a policymaker, have somebody read through that and ask them to take the approach that they have to make a decision on what you have written, either yay or nay. So not just look at things like grammar and spelling, because those are very, very important, but also how are you framing your message? Is it really going to get someone to take action based upon your words? You have to present your message in a very clear and compelling way. There's an old rule of thumb that someone in an executive level position is only going to read the first paragraph. Staffers maybe will read the first page. So you have to be very clear and concise. Less is really more, and you need to lead in with your ask. And then definitely offer yourself up as that expert. Indicate that you have the data, you have the expertise, and you have the knowledge. And you need to present yourself again as that trusted individual who policy and decision makers are going to look toward to have information on making decisions. Telling the story for public health really is not easy. It is more than just a bunch of statistics or infographics. We really want to trigger understanding of the issue, and we want to tap into that empathy that people have and that is likely to drive action and cause decision makers to take action. We tend to think in presentation of data and statistics. And like I said earlier, when things are going well, public health policy stories disappear from the media. Nobody wants to talk about how effective a program has been in terms of statistics and such. But boy, when there's a crisis, they're all over us and they want to hear from us about what we did wrong and how it was not handled properly. So we really need to take the time to build those relationships and to get our stories out there in advance of a crisis. We need to help people understand what is it that we do. If you're with a local health department, how can you present your local health department to be more than just the COVID-19 police? How can you tell the story about the work that you're doing in the community, the populations you're affecting all across the age range? So building credibility in your community, helping people understand what it is every day, developing some good stories to share the impact of our work. Perhaps in your local health department, you assisted a restaurant, a small business owner to become compliant with a new policy or regulation around food safety. So tell that story not from the standpoint of compliance with a food safety regulation, but tell that, make that story human. Talk about how your staff went to a local health department, to a small business, and help them have a better understanding through mentoring and through the time commitment that your staff put in to help them understand the rules and regulations, and how that business owner now has a thriving reputation on Facebook because they have effectively put into practice all of those food safety requirements. That's the kind of story that you will want to tell, because that then will lead to a better understanding of what public health is and what we do. And that helps you advocate later on for improvements or changes to those regulations. Becoming an effective advocate is really also getting to know your policy and decision makers. I talked a little bit about being that champion for issues, being that trusted resources. And here again, it's establishing those relationships before there is an issue. You want to make sure that you know who those folks are. Who are your legislators? Who are your local officials? You want to identify fellow advocates and partners and how you can partner with them on issues. You also want to get to know the staffers. So who are the people behind those policy and decision makers? Is it a policy advisor? Is it at the legislative level, is it an appropriations staff person? Sometimes when we go to a legislative meeting, it's all planned. You have an appointment. You're you're going to get in and talk to Senator so-and-so, but instead, the senator has an impromptu hearing they have to get to, and so they leave your appointment in the hands of a staffer. Don't be disappointed. Staffers are very important to the legislative process. They often do the research behind the legislator's position on bills and on issues. And so talking to that staff person can actually be as effective as, or perhaps even more so than talking to the senator or representative themselves. Sometimes those staffers are the ones making recommendations, and they will call you back after the fact because you have become that trusted advisor. You will be their source, and they will reach out to you in the future for information. You also have to be open to negotiation. Perhaps the policy area that you're working on, in working with some of your other advocates, your fellow advocates, you realize that the position that you really wanted at first has to be moderated a little bit. Be open to that negotiation. Sometimes getting something out of a piece of legislation or a policy issue can be as important as, or more important than getting nothing at all. And it's very true that somebody who opposes you on a policy issue last week or last year may be your partner or may be an advocate for you on another issue area. I can't stress enough how important it is to be polite, say thank you, and follow up timely. In our world today of very quick communications and texting, and we often forget how much of an impression it makes to follow up with a thank you, to follow up with a thank you and say, is there anything else, any other information I can provide you with? And above all, be honest. If you don't know an answer, I have never had a problem saying to someone, I'm sorry, I don't know the answer to that, but I will get back to you as quickly as possible with the information you need. I have done that in legislative committees when I was testifying in front of the General Assembly. And it was always much more appreciated than trying to make up an answer or think up something on the spot that ended up being wrong. And then follow up. So while you're being honest and saying that you don't have the answers at that moment, but you're going to get them, make sure you follow up, because again, that is part of that trusted relationship that you are building to become that effective advocate. I really like this statement from Senator Markey, who's a sitting senator in Massachusetts. Really, advocacy efforts extend way beyond, the Congress or the General Assembly. It's really those grassroots efforts. And advocacy is, it's not just talking to your legislative officials. It's not just talking to your local elected officials. It's really every time you talk about a public health issue, whether it's to your colleagues, whether it's to a community organization, whether or not it's the media, even sitting at your Thanksgiving table with your family and friends, talking about public health issues is a way of advocating. And it is also an opportunity to inform and educate about public health issues. You can also take the approach to use your social media platforms. Again, check if that's allowable in your organization, but you may be able to work with your communications director or with your PIO to talk about how do you reach out, how can you reach out on social media or to your local news organizations to highlight key public health issues and priorities. This is a little bit about who to contact. Clearly we've talked about various elected officials, your local government, state senators, Congress. I talked about the importance of staffers, legislators who really rely heavily on their legislative assistants and their policy staff to be informed about various issues. These links are how to find your U.S. House of Representative, your senator, your Illinois elected officials. The information is out there. These folks are easy to find. Their phone numbers to their offices, their email addresses. You need to reach out. Sometimes we ask legislators for specific issue areas and share information about specific bills or legislation or policies. And you need to have very effective communication. We talked a little bit about being concise and clear when delivering your message, and make sure you include the ask. What is it you actually want them to do, or what action do you want them to take? Elected officials are very interested in knowing how this issue is affecting their state or their district or constituents within the area that they serve. So offering the right data at the right time, or the right anecdote about how a particular issue has affected the senior citizens in your community, or the school-aged children in your community. That really can mean the difference between an elected official making a decision for or against a piece of legislation or making a policy decision. When to advocate is just as important as who to advocate. Although there's really no secret to the timing on when to advocate, the timing of your message is obviously going to depend on what the request is or what information you're trying to convey. Sometimes when legislation is being introduced in the General Assembly, that is really a key time to talk about an issue. When a piece of legislation or policy, when there are committee hearings scheduled, that's another opportunity. Calling a legislative office and advocating for a specific legislative issue in the days leading up to a specific vote, that can be important. If it's a budget matter, for example, funding for a particular program, then the appropriation cycle is the key. It's not really valuable to talk about funding issues in July, for example, because the state budget or local budgets are probably not being considered at that time of year. Advocacy is also a great time for advocacy is when elected officials are in their home district. So that's a really good time to connect with them, not on a specific issue on our specific bill, but doing that storytelling, setting yourself up as a key and trusted advocate. Those are great times to catch officials in a little bit more relaxed atmosphere, when you can set up a meeting with them and you can have a nice discussion around a particular issue. How to advocate, many ways to advocate. The in-person visit can make a very good impression, especially when you're telling your story. Definitely make an appointment, have some written materials available. And again, meet with the staff person if the official that you'd like to speak to is not available. Writing a letter or an email can be a very direct way of communicating on a specific health issue. Again, keep in mind those key components to written communication. Make sure that your message is clear and concise. Make that ask. Above all, make sure that you are addressing your letter or your email correctly. I've seen some situations where public health advocates sent out letters to a whole host of public officials on a particular issue, but they did not change the salutation on their email before sending that out. So everyone got the same Dear Senator Jones email. And how do you think that looks to the elected official when they're getting an email that they think is intended for Senator Jones? Does not work very well, does not make a good impression. Making a phone call. Legislators, policymakers do take note of phone calls that are made to their offices, both their district offices and in our case here in Illinois, in their Springfield offices. Definitely prepare your message and practice it so that you are not stumbling across your words. Be courteous and concise. And don't be offended if you're speaking to a staff person and you can't reach that elected officials. And then, of course, there are the advocacy networks. Organizations like the Illinois Public Health Association, the Med Society for Healthcare Practitioners, the Illinois Academy of Family Physicians for family physicians. There are many different member organizations that do work like we do here at IPHA. We put out legislative action alerts. You can definitely, by being an IPHA member, get that information. We and a lot of the other advocacy networks plan Capitol visit days. Feel free to reach out to us and ask about that type of advocacy work that we're doing. And we're happy to discuss ways that we can get you to learn how to advocate and participate in the advocacy work that we do here. So some of our lessons learned as we wrap up here is that we really need to advocate for public health issues. We are the public health experts. We have the knowledge, we have the data, and we have the stories to tell about public health issues. So if we want to improve our community's health outcomes, public health advocacy is something that we need to do and we need to practice. Education plus action equals advocacy. So when we advocate, we are educating. We are telling our stories and we are taking actions by trying to get our messages and our stories in front of those key decision and policy makers. It's really about building long-term relationships. It is about making our policy and decision makers realize that we can be trusted, that we have the information that they need in order to make a difference in our communities. We talked about a variety of different approaches: writing, calling, visiting, testifying, speaking, and even sitting around the Thanksgiving table and talking to our families about public health issues. We want to be that trusted resource, and we can be, because we have the science behind us to back us in our messaging. And then obviously, don't forget to follow up with those policymakers who actually advanced a public health issue, even if you didn't advocate with them. But when there is a piece of legislation that is passed that impacts a certain population, even if you didn't work on that issue, take the time to say thank you, and offer yourself up as a resource in the future on these issues. That is really going to resonate, and it's something that the policy and decision makers will remember, and they will reach out to you the next time that there's an issue. I've included some resources here if you want to learn more about public health advocacy. The National Association of City and State Health Officers, NACCHO, has a number of resources that are dedicated to advocacy. There are even some toolkits that they have if you want to learn more or do more work with your own staff. ASTO, APHA, the American Public Health Association. You can always look to our website and reach us also. And then I mentioned the de Beaumont Foundation and the Aspen Institute. They have a project called Phrases that talks about new and different ways that we public health advocates can speak to policy and decision makers. The tools we can use, the phraseology we can use to help us tell our stories. So there are many different ways that we can do this and learn from the changing ways we need to communicate to get our messaging across. And of course, we here at IPHA are always here to help. I am happy to serve as a resource for you. Or if you would like me to put you in touch with others who do policy work, I can make sure that you also have those connections and can reach people through me. So that's the end of my Fed talk today. I really believe strongly in the power of public health advocacy and the difference that we can make at every level, whether it's personal or local, state or national levels. We have the power to improve our population's health through the work that we do and the stories that we tell when we advocate. So thank you very much for listening today.
Thank you, Connie. Our next Fed Talk is actually in 2 weeks. You can find the registration for that on IPHA.com, and we will have the recording of this webinar on the IPHA YouTube page in the coming weeks. Thanks, everyone.